Hi everyone. Today we're talking about the importance of getting a good night's sleep. A study came out of Berkeley demonstrating that people who aren't able to achieve deep sleep have a higher risk of Alzheimer's disease. This is attributed to the fact that when we have deep sleep, we are able to remove toxicities from our brain, specifically those beta amyloid proteins that are associated with Alzheimer's disease. So, getting a good night's sleep is not just about improving your energy, but it's also about improving your neurological health. So, some tips on how to get a good night's sleep. First, we want to make sure our room is as dark as possible. That means making sure our alarm clock doesn't have too much of a bright light on it and reducing all of our screen time about 30 minutes prior to bedtime. That means get rid of the iPhones, iPads, Kindles, computers, and even TV about 30 minutes before you'd like to achieve a deep sleep. You can also take a supplement. Magnesium has been especially helpful for people to reduce their spasms, relax their body, and get a deep sleep by taking some extra magnesium. You can also consider trying essential oils. We have a blend here called Serenity, which has been found to be really helpful to diffuse at bedtime or even just put a couple drops on your pillow to help you achieve a good night's sleep. But if all else fails, and no matter what, you just can't seem to get a good night's sleep, you could have some neurological dysregulation that's creating that. You've heard me talk before about how our brain is able to shift gears all day long, going from low gear when we're supposed to be sleeping to high gear when we're trying to pay attention to something. Sometimes people can get stuck in these higher gears, and when they get stuck in that high gear, very often they can suffer from insomnia. And when it's time for them to go to sleep at night, they have difficulty transitioning down into these lower gears. So they kind of stay just a little bit too high. So they fall asleep but wake up. They have trouble falling asleep or they have trouble staying asleep. Anything that happens in their environment brings them up to a waking state very quickly. And this is because they're not into those deeper brainwave patterns. If that's you, there's help available. Neurofeedback can help train your brain into these lower brainwave patterns. This is what BrainCore is all about, and that's how we improve your brain function. So we train your brain, we exercise your brain to get into these lower brainwave patterns so that you can achieve deep sleep. And as I said, deep sleep is so important, not just for our body, but for our brain also. Until next time, thanks for tuning in. Hi everyone, please stay tuned till the end. I have a very special announcement that I'll be making. This month in Time Magazine, an article was done on specific kinds of breast cancer chemotherapy treatments and a higher incidence of suffering from chemobrain. Chemobrain is a condition that affects quite a few survivors, and it's characterized by having challenges as memory deficits and severe cognitive decline. During my treatment, I was lucky enough to have access to neurofeedback throughout the course of my treatment and post-treatment. And what I would do is I would do sporadic QEEGs during my treatment so I could really know objectively how the chemotherapy was affecting my brain. At that point, I continued to do neurofeedback treatments during treatment and post-treatment, and I'm very happy to say that I did not suffer with chemobrain, and I attribute this to neurofeedback. So if anybody knows women out there who are breast cancer survivors who have had the experience of having chemotherapy and are suffering, please pass along this video to them because it can be very, very helpful. For the announcement, when I was diagnosed 3 years ago, it was definitely, there was a lot I had to go through, surgeries and treatments. And when I had completed all my treatments, I expected to just revert back to this old person that I had been prior to. And the Western medical system does a great job of dealing with cancer symptoms for your physical body, but they don't really address the emotional scars that breast cancer can leave behind. And when knowing that what we know and working with people on the mind-body connection, this was something that I needed to explore for myself. There are certain emotions, there are certain conditions that are linked with having challenges emotionally. So, for example, it can be as simple as a Wall Street executive who has a heart attack and they go, oh, well, it was because of the stress. Well, with breast cancer, there are certain emotions that are more toxic for breast cancer survivors. So through my own journey, I found tools that were really helpful in getting me to be like I used to be, to feel as good as I had felt before this whole experience. So I created a 6-part series, a video series for women to really walk them through the journey of how to heal these emotional scars and how to feel better, not just mentally, but physically and emotionally, really on a whole spiritual level. So the course is called healingboobies.com. I would love for you to come over and check out the site, and then check out our Facebook page is also Healing Boobies. Twitter I'm on Pinterest also. And please share this information for any women that you know that have gone through this experience and are still longing to be the people that they were prior to the Big C. Thank you so much for everything. I appreciate all your support. Much love. Bye-bye now. The numbers currently for kids with autism spectrum disorder just came back as 1 in 45. This is absolutely alarming news, and today we will discuss some possible help that is available to families who are dealing with this crisis in healthcare. We also have found out that children that are diagnosed with ADHD later on may actually be considered on the autism spectrum. And the problem with this comes into effect when children with ASD are being treated as if they only have the ADHD piece. And if they only have the ADHD piece and not the ASD piece, then it's not being properly treated. And it's not being properly rehabilitated with things as beautiful as ABA therapy, which can be extremely helpful for kids on the autism spectrum. And most shockingly, some news came out that 1 in 4 preschoolers with ADHD are being treated with psychotropic medications. And remember, these medications have not been tested in children. In fact, I'm going to read a little quote by the CDC Principal Deputy Director, Ileana Arias, is quoted as saying, "We do not know what the long-term effects of psychotropic medication are on the developing brains and bodies of little kids." This is disturbing. This is a crisis. Children are on medications and we just don't know what the long-term consequence of that is. I urge you to take a look at things that are non-invasive for your kids. Certain diets can be helpful, supplements can be helpful, and neurofeedback is one of the things that we use in our office. Neurofeedback is non-invasive. It's level 1 best support according to the American Academy of Pediatrics. So this is not something that's not heavily researched. This is not a new thing. Neurofeedback's been around for 40 years, and it's a way for us to create normal regulation in the brain. So in other words, our brain is supposed to respond to the environment. So we want it to fall asleep when it's time to go to sleep. We want it to speed up when we need to learn something new. Kids with the diagnosis of ADHD and autism spectrum have neurological dysregulation. This is proven. This is nothing new. And so how about, instead of treating them with medications, which can have, according even to the CDC, its challenges because we do not even know what the long-term consequences of use of such medication is. How about doing something to actually get to the root of the problem? And the root of the problem is to retrain their brain in a proper way so that their brain responds to their environment in a more appropriate way. Consider neurofeedback for your children. Take a look at our website to get an idea of how it can benefit your child. Ultimately, doing a QEEG, which is a full brain map, is where we start to take a look at what challenges we see on your child's QEEG. Once we see how their brain map comes out, then we can discuss what possible treatments are available and if they would be a good candidate for neurofeedback treatment. I hope you all have a very happy and healthy holiday season. Enjoy it, enjoy family, and be grateful. Much love. Bye-bye now. Hello. Today we're going to talk about ADHD. ADHD affects children and adults. When people have ADHD, 85% of them have a specific brainwave dysregulation that we see. Basically, a healthy brain is able to switch gears all day long. So it's able to speed up when we want to learn something new, slow down when we want to fall asleep, and stay in a routine or an idle gear when we're doing routine activities. When people suffer from ADHD, what happens is their brain is just staying in this slow gear. And that's why traditional Western medicine's approach to ADHD can be to prescribe stimulant medications. These stimulant medications will take a brain that's performing in a slow level and speed it up. Of course, once the medications wear off, then you're still stuck with the same problem you started with. With neurofeedback, what we do is we reward the brain every time it's producing a higher brainwave pattern. The more we reward the brain, the more we create something called neuroplasticity, which is a big fancy name for new pathways in the brain. The brain then learns to stay in this high gear when we need to focus and concentrate and pay attention. Did you know that neurofeedback is rated level 1 best support by the Journal of the American Academy of Pediatrics? Yes, that's true. So it's a very well-respected therapy and highly researched. The best thing about neurofeedback is it's non-invasive and the FDA reports no side effects. So considering BrainCore, which is our form of neurofeedback, can really help children and adults alike in order to change their brain and change their lives. Until next time.
I guess probably when I was about in my mid 40s, my youngest daughter was showing signs of ADD, so we went and we investigated her, and I was not very receptive to any of the normal clinical things that people do. So I did a lot of research, and at that time when we were doing all that research, it became very apparent that it was something that I have struggled with my whole life. Back then it was just called the ants in the pants and not being able to focus. So when we started her on a medical protocol, I guess, at the same time or thereabouts, I went on one myself. And I guess I was on it for about 4 or 5 years, maybe a little bit longer, and then got introduced to New Life and learned about BrainCore and decided to try it, and just have had fantastic results. Totally med-free. My youngest daughter we've reduced her medicine. My oldest daughter has anxiety issues, and she's seen great improvements with it also.
Chris came to me and we did a diagnostic procedure on her called a QEEG, and what we found is she also had an elevated theta-beta ratio, which is seen in 85% of people with ADHD. It's really the classic hallmark sign to let us know as BrainCore doctors that we can effectively help a patient. After 20 visits with Chris, she saw a dramatic improvement. In fact, she's completely off medication and has maintained that for over 4 months we're at right now. So really dramatic result within way under the 30 visits.
I have recommended BrainCore to pretty basically anybody who I meet because I think the benefits are far-reaching. I think, I have 3 different examples in my family. My youngest daughter is ADD. We've been able to reduce her medicine. I have ADD. I've been able to come off medicine. My oldest daughter has anxiety issues, and she's just been through some pretty anxiety-induced circumstances with college, and she made it through fine. So I have very concrete proof that it does work.
Hello.
Hello, how are you?
Well, how are you?
Good.
Thank you so much for coming in today
No
and
problem.
sharing your story with other people. We're hoping this is helpful.
Yep.
So, what brought you to BrainCore?
Well, a while back I had a football concussion, and it was very bad. It was giving me abdominal pains, and I wasn't really able to sleep.
Okay.
So, yeah.
And so, before you sought care with me, you had been to other doctors and
Yes.
to other kinds of modalities. What things did you do, and what didn't seem to really help you so
Um,
much?
I went to a GI doctor for a
Okay.
long time, and that didn't really help me. I went to a couple of like chiropractic, but like different places, and
Okay.
they weren't really helping.
Okay.
So, Yeah, that was really what I tried before I came.
And how did you find Brain Core?
My mom really on the internet. She looked
Okay.
it up and she found you guys. Yeah.
Excellent. So tell me, remind me, what was your life like before Brain Core? What were you struggling with?
Yeah. Well, I wasn't in school for a whole year. I had home tutoring, and I couldn't sleep, and I would really just want to stay in my room. So I was very depressed, and I would like moan to try and take care of the pain.
Okay,
So, yeah.
So the pain was so intense. You
Mhm.
were totally out of school.
Yeah.
Okay. You weren't really able to leave your room. You
No,
were doing
yeah.
homeschooling basically.
Yeah.
And as far as going to Western medicine, you really weren't getting anywhere.
Yeah, I wasn't really getting any results. Or anything,
Okay.
Yeah.
Okay. And so then you came here and we met.
Yep.
And Tom was always, you know, for everything he'd been through, he was still really open
Yeah.
to trying something,
Yeah.
right?
Mhm.
And I did a brain map on him, and I found a form of dysregulation that's associated with things like chronic pain. So we spoke about trying neurofeedback, and so tell them what happened.
So in about the first week that I started, I was able to sleep better. So that was always a plus, because if you don't sleep, that's terrible.
Right,
So
that's where we repair, right?
Yep.
Is in restorative sleep. Great.
Mhm.
And then what happened a few months later?
then about 2-3 months later, I noticed that my abdominal pain went down.
Great.
So that was always good. Yeah.
Excellent. And so how is your life different now?
Now I'm back in school, and
Excellent.
I'm glad to say I'm sleeping through the night. So it's very good. It's much more enjoyable than what it was.
And how about the depression and specifically the chronic
Mhm.
abdominal pain?
The abdominal pain, I haven't had it for a long time, and I hope I never have it again. And and the depression, I'm fine. You know, I'm the same person that I used to be.
Great.
So I'm glad I am. And yeah, so
Great.
life is much more enjoyable than
Excellent.
it was. Yeah,
Excellent. So you're happy you found Brain Core.
absolutely. Yes.
and what other things you had spoken about, you know, faith and and other
Yeah,
things
like
out there.
before I came here, you know, all the doctors, they would tell me, like, oh, there's things like, and they made it sound like I was faking it. So that was very upsetting to me, because it's me, and I felt the pain. So when I came here, I was trying to be as open as I could, but I really didn't have much faith in anyone, really. And then once I saw that I was sleeping and stuff, I just had all that back, because now I knew that I actually had hope that I could feel better.
Yes.
So, yeah,
Well, you know, I'm so happy that
Thank you.
neurofeedback helped
Yeah.
you.
thank you.
And I can say that he was always one of my favorite patients because he was so appreciative of the changes
Thank you.
and he followed his protocols very carefully.
Mhm.
And we're happy to say that this is all behind him now.
Thank you.
Thank you.
Thank you.
People take medication every day for anxiety, depression, even insomnia. But a new technique could make it all go away by simply using your brain power. CBS 2's Andrea Grimes shows us how you can train your brain.
When it's light or bright, that's when she's producing the desired brain wavelength.
That's right. This patient is manipulating the brightness of the screen with the power of her mind. It's a treatment called brain core therapy.
Your brain is constantly being molded with a feedback mechanism, a positive reinforcement to show you that this is the proper brainwave pattern.
Positive reinforcement for this therapy entails making a video screen appear lighter, or here, keeping a roller coaster moving smoothly. It works, according to Dr. Carrie Chapino, by patients concentrating on these activities. She says research shows that over time, the brain will establish new connections that can help break the cycle of depression, insomnia, and certain pain.
I'm not about to get a facelift, but I can give my brain a lift.
Marilyn Sokol says she was having issues with mood, focus, and trouble sleeping, so she tried brain core therapy.
I'm really sleeping and not getting up for any reason.
She saw other benefits too.
I was always a slow reader. I do believe that there has been an improvement.
Brain core neurofeedback therapy begins with a comprehensive evaluation. This evaluation includes a quantitative electroencephalogram or QEEG evaluation. During this evaluation, we are able to read and record brainwave patterns at 12 different sites in the brain. Our software then identifies where the brainwave patterns are abnormal, and then the neurofeedback protocols that we use are designed to specifically address those patterns that are abnormal in that particular patient. So for instance, if a patient is producing too much beta waves, the neurofeedback protocol for that patient would be to teach them how to produce less beta waves. And we do that through operant conditioning or a learning modality. A good example would be where the patient is hooked up to the computer using wires that are pasted to the scalp. It's completely non-invasive. There's no pins, there's no needles, it's painless. And those wires are basically just reading the patient's brain waves coming from their brain. The computer software then is going to reward the patient when they're producing the correct brainwave pattern. So, for instance, the reward might be a DVD that the patient is watching. They could be watching a movie, and the movie is either going to play when they're producing the correct brainwave patterns, or stop when they're not producing the correct brainwave patterns. This is simple operant conditioning. Over time, the brain learns that if it wants to see the movie, it's got to produce the correct brainwave patterns. The brainwave circuitry is then reestablished in the brain, and the new activation patterns that have been produced by the brain can now be used out in the normal environment. So now the child who was in the classroom falling asleep is no longer falling asleep, because they know now how to produce more beta waves and less theta and delta.